Welcome, everyone. Thanks for joining on this beautiful spring evening. So I'm relying on the sunlight, so the lighting may change during the course of the next hour and a half. And just like with all our regular talks, please put your phones on mute. And you know where the washroom is? It's just out the door and to the right. And remember to wash your hands after you leave. And this talk is brought to you by the Burnaby Division of Family Practice, and in particular, Leona Cullen and myself. Leona has been the backbone of this program since we started over 6 years ago. So she's really been instrumental in allowing us to continue during the pandemic, because this normally would be an in-person talk. But I don't think we'd be able to do it in person because Leona said over 130 people registered already. So that'd be a lot of people. We don't have any venues that we could do that in. But we're hoping to, when things are safer, do this live. But I think the Zoom really reaches out to lots of people. I know a lot of people feel uncomfortable with the technology, so it'd be nice to do in person again. So looking forward to seeing all of you in person someday soon. And Leona has a list of useful links in the chat. So if you don't mind me turning it over to Leona for a second so she can just point those useful links for you.
Sure, no problem. Welcome, everybody. It's such a beautiful night here in Burnaby, but happy you're taking the time to join us. So I'm going to put some materials in the chat for you. The first link is going to be our Empowering Patients main page that includes the registration link and information on our next and last talk of the season, which is in April, and plus videos of all the talks that we've done over the past year. So if you've missed us and you want to catch up, there's links to those. The second link I'm going to put up is all of our Empowering Patients resources. So every presentation that Dr. Wong has put together and information sheets for each of the talks that we've done are going to be there, and you can print them, you can do whatever, share them with your friends, do whatever you like. I'm also going to share the link to our Burnaby PCN website, where there's lots of resources for community, social services, doc talks, other informational videos. So please check out that site, because there's a lot of information for yourself and/or you can share with your friends and family. And the last link I'm going to share with you is we do a weekly COVID roundup newsletter. So it's basically just vetted information on what's going on in the world of COVID from various different sources, including social media posts, that type of thing. You can subscribe to that. So I'm going to post the last issue, which was March 25th. In there, you can subscribe, have a read, and one of those will come out every Friday. So that's it. I'll start populating the chat.
Thank you, Leona. So as you can see, Leona is very busy even outside of our Empowering Patients program. So we're really grateful for her assistance and all the work she does for the Burnaby Division. And in case you didn't know what the Burnaby Division is, it's a nonprofit association of the family doctors that serve the Burnaby population. That includes all of you. So a lot of our patients actually fall out of the Burnaby area. So it's mainly doctors that are Burnaby based, but we welcome all of you that are in and outside of Burnaby as well. And of course, I'm really committed to Burnaby because this is my hometown. And this is just one of the ways that I feel that I can give back to my hometown community. So today's topic is making sense of symptoms and screening tests. And that's so important during the pandemic because a lot of you haven't seen your family doctors and may have let some symptoms and things kind of hang on and not sure if you need to check in with your family doctor. I've heard a lot of people having trouble accessing their family doctor when they do have a family doctor, not knowing if the lines are just busy or if their office is closed. I've checked in with our Burnaby Division staff. They checked in with most of the family doctors in the community, and they're all majority, like over 90%, their offices are still open. Our office at Prime Care is still open. We're still seeing patients in person as well as through telehealth, like video or phone as well. Although during the stage of the pandemic, a lot of the stuff, probably 60 to 70% of our consultations with our patients is virtual, either video or by phone. But we definitely see people for their pap smears, important physical examinations, and a lot of things that you just can't diagnose and treat properly just by the phone. I know that's been a big challenge for a lot of patients, a lot of members of the public over the past couple of years. And I know there's a lot of people that don't have a family doctor. So this talk is really helpful because you'll know what screening tests you should do, even without any family history. So you'll know what things you should be asking a walk-in doctor that you might go to, or an urgent care clinic doctor, to ask them if they can order some of these tests for you that you're due for. And also important to point out some symptoms that might indicate a more important condition that you should see medical care to help. So none of our talks or any of the stuff in the Empowering Patients can substitute for medical advice. So don't take it as medical advice, but just kind of support and guidelines. In your particular conditions, it's best to talk to a healthcare professional. So you can actually ask the physician that you see at a walk-in clinic, if you can't see your family doctor, about these screening tests. If you do have a family doctor, it's best to do it through your family doctor as well. So again, brought to you by the Burnaby Division of Family Practice, and check our website for a lot of resources on COVID, on finding a family doctor if you don't have one, and of course our Empowering Patients information and other talks that the division hosts. So why are we here? I'm here because I care about my patients, but I also care about my community where I grew up. When I was in grade 6, I was hospitalized at the old Burnaby Hospital, which looks identical to the current Burnaby Hospital. It actually hasn't changed very much. But I was there for 2 weeks in grade 6, around age 10 or 11, because I had a big flare-up of rheumatoid arthritis, which, as you know, is not just involving the joints, but it can involve fevers and rashes and vasculitis. So I was in a lot of pain, a lot of unknowns and questions, but I was really comforted by the healthcare providers, the nurses, my own family doctor, Dr. McCarthy, who came in to see me, and my pediatrician, Dr. Will, who came and looked after me. And they were treating me as a kid, a whole person, and not just my medical condition. And I realized that's what I wanted to do. I wanted to help people that needed that expertise and support, but most importantly, that human touch. And of course, the nurses seemed to be working a lot harder than the doctors. And it seemed like the doctors, anything they prescribed or told me was something I read in the Family Medical Encyclopedia. So I obviously, being a lazy kid, chose the easier job, medicine. Ended up being more complicated than I thought, but I still admire the dedication and the hard work of our nurses. We can't do any aspect of healthcare without our allied healthcare support, particularly our nurses. And we care about our future, because I know I can only look after my patients and my community for my lifetime, but I want to impart skills and knowledge and confidence in my patients and you, our members of the community, so that you have the confidence and an approach to manage your own health. So as family docs, all the docs in the community, in all the divisions across the province in Canada, we care about our patients as whole human beings. And in family practice, I think it's a really unique perspective from the specialties, because we don't treat disease. We only see conditions within the context of that whole person's life. We look after, we care for patients, the whole person. And our care is longitudinal over a lifetime. And I've been doing obstetrics for 31 years, and about at least 90% of my patients that are under 30 are patients I delivered as babies sometime in the last 30 years as well. So that's kind of wonderful for me to develop that relationship over time. And I look after my patients all the way until they're in the community, long-term care, or sometimes palliative care at the end of life as well. So it's really touching, and it's really meaningful for both patients and doctors to know each other and to build trust and confidence over time. And it gives us that great perspective over time. It's longitudinal, but I think it's also latitudinal because it has a lot of depth and breadth, knowing the patient's values and goals and their stories over a lifetime. And we care about our community. So we've been really active in the Burnaby Division in reaching out and working with our partners through Fraser Health and a variety of our community partners, just to provide the best care for everyone in our community, because all of us are responsible for each individual in the community. You're responsible for your neighbor as well. So today we're going to be talking about the 4 foundations of self-care, looking after yourself. We'll talk a bit about the complete physical and talking about important symptoms to watch out for that used to be covered when we asked questions in that traditional complete physical exam. We'll talk about alarm symptoms. So these are symptoms that require very prompt medical attention. I actually have a little poster in my exam rooms saying that if you have any of these symptoms, it doesn't matter what you bring and we have to attend to these alarm symptoms right away, because they might indicate a stroke or a heart attack or something that requires much more immediate attention than a mild rash that's not cancerous. And finally, we'll talk about the screening tests that are recommended, just evidence-based screening tests that we should do as adults, depending on our gender and our age. So part of the resources for this is a poster I put together of those screening tests, like a 1-pager. So if there's no link in the chat, you'll find it on the Empowering Patients side for additional resources for the talk. So it's good to kind of download that so you have that as a guide so you can bring that to your doctor. And if you don't have a family doctor, then maybe ask at the walk-in clinic if you could do one of these tests, like checking the stools for blood if you're over 50. So just a little perspective, what is healthcare? Is it the management of disease? Is it the acute care in the hospital and the emergency? Is it the specialist care? Well, if you ask a family doctor, they'll say most of it is care in the community, prevention and chronic disease management. But really, the person that provides most of your healthcare is not me or the nurses or the pharmacists, it's you. And healthcare professionals like myself are just here to support you with knowledge and connecting you to the resources you need and some guidance, and to recognize important symptoms and recognize conditions and how to keep ourselves happy and healthy, so that emotional, physical well-being, which is more proactive and preventive. So there's acute care that we see the flashy stuff, expensive stuff on the surface, but the real mainstay of your healthcare is what happens in the community, managing chronic conditions, healthy daily habits, which we've covered in our talks on empowering patients, and being really proactive and preventive in your care rather than reactive. So I believe real healthcare is self-care, and the person that provides most of your healthcare is you. And the best predictor of your future health, well, with respect to those things that are under our control, are the habits you practice every day. So I consider those 4 foundations of self-care to be what you eat, which is what you put into your body. And this is the topic of our next presentation on April 21st, and I'll give you a reminder at the end as well. But also what you put into your body, like things that may not be so healthy, like excessive alcohol and some recreational drugs or excessive caffeine. Second foundation is what you do, physical activity balanced by healthy rest and sleep. The third foundation, how you feel, emotional well-being. And the fourth, how we connect, healthy relationships. And each of these have been a topic, and we have videos online as well through our division site, the Empowering Patients program. So if you're running low on things to watch on Netflix or Disney Plus, then check out some of our videos. So again, what you eat, what you do, how you feel, and how you connect. So what we all need for good self-care is unbiased medical information, because I noticed that the majority of information we get online, on the radio, on television, is often sensationalized, and it's often someone trying to sell you something, including Dr. Oz selling you something. We need to support you in adopting healthier lifestyles to manage health conditions, and we've had talks on heart disease, high blood pressure, and diabetes. And we'll have upcoming ones on respiratory conditions as well. And you also need support to know where to get help when you need it. You also need good communication between patient and doctor. Again, another of the talks that you may want to watch online with some healthy tips. We have key point handouts for each of our talks too. And that's a really useful one for you to take to your doctor to make sure all your questions are answered, to make sure you have all the information you need to make an informed, ethical decision about taking a medication or choosing to do an investigation or an operation. So the complete physical is not something that's routinely covered by the medical services plan. So you can't call your doctor to book a routine physical because it won't be covered by MSP. So the medical services plan specifically must say that there must be a medical justification for the complete physical. Examples would be prenatal care for a mom that's pregnant needs a complete physical because we want to recognize disease in other organ systems to see if that would affect the pregnancy and the health of the mom and the baby. When you have chronic conditions such as congestive heart disease or coronary artery disease, narrowing of the arteries of the heart, or diabetes, which are more systemic conditions that require a complete physical examination, or symptoms that might suggest a serious systemic condition. So unless the physician can justify this to MSP, the physical is not covered. I know of some practices if patients just want to do a head-to-toe complete physical, that they can do it, but they would get a private fee for that. And of course, driver's medical exams that are required for commercial driving or when you're over age 80 are not covered by MSP either. So examples of these, the driver's medical exam, employment physical, athletic physicals, industrial first aid physicals, physicals and forms for recreational diving. These are not covered by MSP, so we have to charge you privately for those. But one part of a complete physical are these key questions about the different systems of the body. So because people don't routinely have physicals, you may not have been asked these questions. So making sense of symptoms, I'll be going through the typical questions that we ask when we're doing a physical so that you can recognize if any of these symptoms you may have had during the pandemic do require you to contact your doctor or to see a physician through an urgent care or walk-in clinic. So these are the key questions that might indicate underlying disease. So the most important thing is if you are a hypochondriac, please leave now. Because if you are, then you're going to be very alarmed. But remember, none of these necessarily mean something serious, but they do prompt you that you should discuss it further with a healthcare professional. So the general symptoms we usually ask are, has there been a change in your energy level? Because a decrease in your energy could be due to a variety of things. It could be due to depression. So depression, even though we think of it as an emotional condition, affects us cognitively, how we're thinking, like memory and concentration. It affects sleep. We can sleep more or less, but it does affect our energy level as well. An underactive thyroid gland, which is a gland here in the throat that controls our energy level, if it's underactive, that could also make us feel really fatigued with other symptoms like gaining weight and feeling cold all the time. And of course, if you're not sleeping well, if you're having difficulty falling asleep, waking up in the middle of the night and can't sleep, or waking up really early and can't fall asleep again, lacking those 7 or 8 hours of sleep is going to make you fatigued. And a lot of people are sleeping more than 8 hours, but their sleep is non-restorative because they may have sleep apnea. So that's a really common condition. And so one indicator could be really heavy snoring, but not everyone that snores has sleep apnea. But some people that snore really loudly could be from the throat because our soft tissues might get a little bit lax and then partially close our airway when we're sleeping and relaxed. Our oxygen levels would drop and then we'd feel unrestored in the morning. And the key symptoms would be feeling really drowsy and sleepy during the daytime, like stopping at a traffic light and then dozing off, or being a passenger in a car and dozing off during the day, or falling asleep in a boring meeting or during a boring webinar. So hopefully none of you have sleep apnea or sleeping right now. And hopefully this webinar is not boring and you're falling asleep. But if you think you might have that, you should contact a healthcare professional because there's easy screening tests we can do to check for that, like checking your oxygen level overnight with a device that you can just borrow from a clinic overnight. A respiratory condition could also make us feel fatigued, like chronic lung disease. Heart failure, where the heart's not pumping strong enough, will make us feel physically fatigued as well. If your red blood cell count is low with anemia, that will make you feel really fatigued because the red blood cells carry oxygen and therefore energy to all the cells of your body. So if you're low in iron or anemic for other reasons, that could be a cause for feeling really tired all the time. A lot of our medications can make us tired. For example, beta blockers for blood pressure and for the heart tend to make most people feel more tired. So after people have had a heart attack, for example, they're always put on beta blockers and other medications that lower blood pressure, and that can cause some fatigue as well. So often the cardiologists and physicians will modify the medications once you're out of a certain time frame. Some other blood conditions include leukemia, which is abnormally high white blood cells, and this could be marked by fatigue plus other symptoms. And similarly, lymphoma, which is a cancer of the lymph glands or the lymphocytes, the white blood cells, can also cause fatigue, as can other types of cancers. So if your energy is low, it's probably not cancer, but if it's persistent and there's no obvious cause, you should contact a healthcare professional. They'll be asking a lot more questions and they'll be able to pinpoint what investigations we need to get to the bottom of it. So don't think that you have all of these things or necessarily any of them, but do check it out. Now, not too many people complain about increased energy, but if you have an increase in energy, it could be from anxiety, where you're feeling hyper and alert and you can't sleep, or a condition called mania, which is the total opposite of depression, where you have increased confidence, increased energy, decreased need for sleep, feel you can take on the world, and having lots of physical energy. That could be a symptom of a manic episode or mania. Of course, there'll be other psychological symptoms as well. And of course, some medications, like if we're supplementing a thyroid or using medication that's a stimulant, like for attention deficit disorder, this could increase our energy too and cause insomnia or tremors or shakiness. An overactive thyroid, the opposite of a hypothyroid state, can make you feel hot, make you lose weight, make your heart rate faster as well. And there's a variety of hormonal conditions that can increase our energy as well. So although we think increased energy is good, if it's actually causing things like losing weight, losing sleep, affecting your function or your thinking, it's important to check it out. Another general symptom would be, have you gained or lost weight? Now, a lot of people think COVID-19 is the 19 pounds people gained in the first year of the pandemic, which was really common because of a lot of our routines, like a lot of our community centers and pools were closed, and all of the things we used to do outdoors, out of the house, we didn't have access to. And Uber Eats and other delivery things were kind of nice for a variety. So weight gain could be from the pandemic, changing our lifestyle, could be from the holidays, from eating a little bit too much or decreasing our activity, but it could also be due to diabetes. So type 2 diabetes in particular makes us more hungry, can make us gain weight, especially around the abdomen. Heart failure, where the heart's not pumping as strong, can make us retain fluid, and it could be more water weight, just swelling in the ankles and legs could be a cause for weight gain. Kidney failure with retaining fluid can also cause weight gain, as can a variety of medications, and of course, an underactive thyroid. The opposite, losing weight, could be due to anorexia with restriction of your diet or no appetite, or if you're just not eating enough things for healthy nutrition. Again, the topic of our April 21st talk, healthy diet. Depression can sometimes cause weight loss, as can stress, loss of sleep, excessive exercise, or a condition that causes diarrhea, or conditions where you're not absorbing all your nutrients. If you have a parasite like a tapeworm, that can cause weight loss as well. And of course, there's a variety of medications, and of course, smoking, some types of cancers, and an overactive thyroid can also contribute to the weight loss. Do you have increased hunger and thirst? So it could be a symptom of high blood sugars, like diabetes. And how is your sleep? So sleep could be disturbed by, again, overactive thyroid, anxiety, depression, manic episode, chronic pain, urinary frequency, which is more common as we get older, from shift work, because you have to change your sleeping times frequently, and sometimes pregnancy from the discomfort as we get into the second and third trimesters of the pregnancy. And just having children, you lose a lot of sleep. So let's cover some specific organ systems or the neurological system to start with. So some questions that we would normally ask in the review of systems. So are you having headaches? And of course, there's a variety of different types of headaches. Tension headaches are more common, but a lot of people have migraine type headaches, or you can also have headaches from the sinuses. Less likely, but more serious would be something like a brain tumor. So some warning signs or red flags would be headaches that are progressively getting worse, or headaches that are associated with progressive drowsiness, because this could indicate increased pressure within the head, either from a head injury, which can cause a slow bleed, or from a stroke, or from a brain tumor. So if you're having increased or changes or new headaches or severe headaches that are getting worse, definitely it's worthwhile checking with a doctor to make sure, get a physical, make sure we don't need to do more tests. And of course, progressive symptoms with any changes in your behavior or function require prompt medical attention. Another neurological symptom or question to ask is, do you have tremors? So tremors are just shakiness, commonly of the hands, but it could be other parts of the body too. So there's common familial tremors that's often at rest. Those are very common and not serious, but then there could be some tremors that are more in keeping with Parkinson's disease or other movement disorders. So if you have the new onset of a tremor or a worsening tremor, it's worthwhile checking that out with your doctor as well. And dizziness, very, very common. And it's often hard to kind of pinpoint what kind of dizziness there is. So there's one type of dizziness that's just lightheadedness. So this could be to non-neurological causes such as low blood pressure, low blood sugar, or anemia, a drop in your red blood cells. That can cause lightheadedness, particularly when you're standing up. Vertigo is another type of dizziness, and this is an exaggerated sense of motion. So often it's due to the particles inside the inner ear. So you see the little diagram that's on the left. So you're familiar with the external ear, the ear canal, the eardrum. That's pink in this picture. But that little blue area is in the inner ear. So there's two special organs in the inner ear. There's the cochlea, that looks like a snail. So that's the hearing organ for the hearing. And then those little rings on the top of that are the semicircular canals. So that's the vestibular system that controls our balance. And those little semicircular canals are oriented in three directions associated with our head movements, like forward, side, and rotation. So sometimes the little particles inside could be shifted from being an unusual posture or a head injury, and the particles need to be repositioned by a physio, by a physician as well. So vertigo is sometimes caused by what we call peripheral vertigo. It could be caused by some movement in those cells from unusual postures or positions. But vertigo, that sense of being off balance with a little movement, could also be disorders in the base of the brain, the cerebellum. So the diagram on the right, the cerebellum is at the base of the brain, is also responsible for our sense of balance too. So vertigo is that kind of feeling you have if you jumped onto a merry-go-round and then jumped off. So that sense of things spinning around in exaggeration with maybe just a little bit of movement or no movement at all. So quite different from that lightheadedness or feeling like you're going to faint. So again, 4 types of dizziness: that vertigo, that strong sense of motion or spinning; disequilibrium, just feeling a little bit wobbly and off balance; lightheadedness or feeling woozy, kind of spaced out; or presyncope, to feel like you're about to faint, often with a drop in your blood pressure. So if you have persistent vertigo or vertigo associated with other neurological symptoms, that requires prompt medical attention. Do you have any numbness or altered sensations anywhere in your body? So it could be from specific things like numbness in these 3 fingers on the palm side, can commonly be due to carpal tunnel syndrome or pinching of the median nerve at the wrist if we do a lot of work that involves typing, lifting, a lot of wrist work. There's another way that nerves could be pinched, like in the lower part of the spine. You could have sciatica, where the lumbar and sacral roots are being pinched as they go down the leg into the foot. And that could be from arthritic changes or a disc herniation. There could also be a growth in the spinal cord, which can affect the nerves downstream from that level in the spinal cord from the neck down into the lower spine, or a stroke, or multiple sclerosis or tumor, or other conditions in the brain or central nervous system can also cause altered symptoms as well. So this definitely requires medical attention to see if it's something that's benign and treatable or something that's more urgent that needs more extensive investigations and other treatments. Have you had memory problems? So of course, it could be normal aging, it could be anxiety or stress. As I mentioned, depression can have memory and other cognitive symptoms. Attention deficit disorder can make us inattentive and then forget to do things. And dementia or progressive loss, pathological loss of your memory, short-term memory that's in advance or more than we'd expect for age alone, and other conditions that affect the brain. So if you have worrisome problems with your memory that you notice or other people have noticed, definitely seek some help with your physician. Many of them are treatable and reversible, so don't hesitate to get it checked out. A neurological emergency would include a seizure. So this is a temporary loss of consciousness associated with involuntary movements. So if someone has this for the first time, it does require calling 911. So the person is unconscious, unresponsive, and there could be abnormal movements, either involving the whole body, we call it a whole generalized tonic-clonic seizure, or it could be just a portion of the body, or like around the mouth, or just one hand or one leg. But a stroke can look very, very similar as well. So you would call 911 if the person has had this for the first time and they're not known to have epilepsy. A stroke has a variety of symptoms. So that's a sudden appearance of neurological symptoms such as weakness of a part of the face, or one side of the body, or the arm or the leg, or numbness in similar distributions, or a loss of speech, or inability to pronounce things properly, or loss of vision in one eye or a portion of both eyes, or severe loss of balance or sudden behavioral changes. So these are symptoms that shouldn't wait the next day to see a doctor. You should call 911 if you think you've had a stroke or someone who's with you has had a stroke. Don't just go to bed and hope that it gets better. So the sooner we recognize it and treat it, the better, because sometimes we can reverse it. The picture in the bottom just shows one type of change in vision you might have if you had a stroke involving one side of your brain. So that side of the brain, you may lose vision on one side, so that both eyes would have just half the vision. Our technical name is homonymous hemianopsia. So head and neck symptoms that we would ask in the review of systems. Do you have problems hearing? So hearing could be noise-induced or age-related. It could be a result of strokes or tumors. It could be from earwax, or it could be just plugging up in that tube that connects the back of the eardrum, the middle ear, to the back of your nose and throat, the eustachian tube, like you feel if you go up, driving up the Sea to Sky Highway or the Coquihalla Highway and your ears pop. That's the type of congestion we get in the eustachian tube commonly with allergies and colds or going on an airplane. Tinnitus, not tinnitus, but tinnitus is ringing in the ears. So that may be related to high frequency hearing loss or a condition called many ears disease, or sometimes it could be just simply from blocked eustachian tubes, which is very treatable. This could be a very bothersome symptom, even though it's not necessarily curable. So if you are bothered by tinnitus or the new onset of tinnitus, do see your family physician first, and he or she may refer you on to a specialist or some hearing tests as well. Do you have difficulty breathing through your nose? So that could be simply a cold, COVID, allergies. It could be if your nasal septum is deviated to one side, It could be due to foreign bodies, which is more common in little kids that often stuff crayons and other things in their nose. Or it could be from a tumor. So in Asian people, nasopharyngeal carcinoma is more prevalent than in other ethnic populations. So we don't want to ignore chronic persistent nosebleeds and nasal obstruction. And of course, have you been bothered by nosebleeds? They're usually minor, but they could indicate a bleeding disorder or nasopharyngeal cancer. So if you are bothered by persistent nosebleeds, particularly just from one side, or nosebleeds that last more than 20 minutes, even though you're putting compression and leaning your head forward, do check with your doctor so they can check the inside of your nose. And if needed, we could send you on to a ear, nose, throat specialist. Do you have double vision? So double vision is when you know there's one thing, one finger in front of you, but you see two fingers. And of course, if you hold your finger really close, you will see double. But if you're seeing double vision, that could be caused by an imbalance of the eye muscles, or it could be due to the nerves that go to the eye muscles. So it might indicate tumors or other things within the brain that could be changing your vision. So that's really important to get that checked out with a new onset of double vision. And of course, if you have a sudden loss of vision, that is an emergency. Try not to wait till the next day. It's better to go to the emergency or contact your eye doctor. It could be a symptom of stroke, or it could be a symptom of a retinal detachment. So I had a retinal tears, which had similar symptoms to a retinal detachment. So I typically swim in the pool every day, but it was a particularly busy lane at Eileen Daly on a Saturday morning. And the signs are not multilingual, so fast, medium, slow is misinterpreted by different people from different places. So there's one gentleman who was just waiting at the end, and then after I'd done my flip turn, decided to launch off after I had already made my turn, and he did a slow kick into the side of my head. So that impact was enough to cause a little concussion, but later in the day, I started seeing flashes in the peripheral of my vision in the left eye, and a sudden onset of new floaters, which are little translucent things floating around that weren't there before. So I recognized the symptoms could be a retinal tear or detachment. And so I called the emergency, went to VGH Emerge. Unfortunately, they didn't have any ophthalmologist that would see me. So I kindly called my own ophthalmologist the morning, Dr. Michael Boyd, and he saw me right away, dilated my pupils, confirmed that there was a retinal injury, and got me seen by the retinal specialist. And I had laser treatment the same day to prevent further injury to my retina. So you definitely don't want a whole retinal detachment. So once the retina, the back of the eye separates completely, then it's not fixable. So if you get sudden loss of vision or flashes in your vision, it requires immediate attention to your personal ophthalmologist, if you can contact them the same day, or the emergency department. Musculoskeletal symptoms. So this is how I fractured 7 ribs. It was actually 9 fractures, but a couple of ribs are fractured front and back from the flying trapeze. It was just a new trick because I was getting so good at it. So my patients have just 1 rib fracture. I kind of understand how they feel, and I try really hard to be empathetic when I'm thinking about 9 fractures. But have you had swelling or stiffness in the joints? So this could be a symptom of inflammatory arthritis. So inflammatory arthritis is different from the wear and tear arthritis, osteoarthritis that we all eventually get in the bottom of our neck, bottom of our lower back, in our knees and our hips over time as we get older. So most of us in our 50s will have some degree of arthritic changes as the cartilage gets worn down on the big weight-bearing joints, usually knees, sometimes hips. And often our little fingers, the distal interphalangeal joints. So some people, when they get older, it gets really knobbly in these areas. So that's usually a sign of the wear and tear osteoarthritis. But inflammatory arthritis, like when I had as a kid, affects other joints. And so it involves the hand. Often it affects these metacarpal phalangeal joints. So they'll be swollen and puffy, particularly in the morning for at least an hour, And sometimes these proximal interphalangeal joints can be swollen and like sausages as well. So we see that with psoriatic, rheumatoid, and other types of inflammatory arthritis. And gout is another type of inflammatory arthritis. Typically, the big toe gets affected, but it could also be elbow, knee, and other joints too. And in the case of acute gout, that joint is red and hot to touch and swollen, and just moving a little bit, it causes really severe pain. So if you have swelling of the joints, do have a physician check your joints and to take a good history. We'd probably send you for some imaging like x-rays plus blood tests to confirm inflammatory conditions. And these are treated not with just Advil or rest or ice, but there's specific conditions that prevent damage to the cartilage and the joints. Have you had locking or decreased range of motion in your joints? So it could be due to degenerative changes, or it could be due to an injury of a joint. So the x-ray that's labeled where it says L on the left, you see the narrowing of the joint space. It doesn't look quite as black and wide. So that's an indication that in this person's left knee, they have quite advanced osteoarthritis, the wear and tear arthritis of the knees. So let's go on to cardiovascular symptoms. Have you had chest or neck or throat or arm pain or pressure? So as I mentioned in our talk on what you should know about heart disease a few months back, these could be the symptoms of angina, which is a decreased flow of blood to the blood vessels that supply the heart muscle itself, not the blood that flows through the heart to the rest of the body, but the very arteries, the coronary arteries that give supply to the vital heart muscle. So if there's increased demand on the heart, like it's pumping faster with stress and with exercise, and the symptoms come on in the chest, throat, or nausea at the same time, those could be symptoms of angina or decreased circulation to the heart muscle. There could be narrowing or spasm of the artery supplying that. That's called coronary artery disease. Do you get palpitations? So that's where you're feeling sensations of pounding in your heart, skipping beats or pauses. We all get occasional extra beats, and that can be quite normal. But if it's something that's noticeable or makes you feel dizzy or lightheaded or causes you some concern, don't hesitate to see your doctor. We can get a good idea by checking your pulse. A lot of us have EKGs we could do on the spot, or Apple Watches, which I've used to diagnose irregular conditions like atrial fibrillation in the office as well. We get a good idea by feeling the regularity of the pulse, but it's nice to do the EKG to confirm. So if you notice the new onset of palpitations, even if you're not short of breath, get it checked out for a physical examination. You can't do this on the telephone. Do you have pain in your calves when you're walking? So most people think that's just tight muscles or a little bit out of shape. But that could also be the circulation to the arteries that supply your calf muscles. So this could be something similar to angina, but involving the muscles of your legs. So if you have pain in your calves when you're walking, but when you stop, it gets better and then comes back again when you start walking again, this could be a blockage of the arterial circulation. And it's the same risk factors that can cause heart disease: aging, smoking, high cholesterol or diabetes, and high blood pressure. Those are common causes or problems with blood clotting. So this would warrant seeing your doctor as well. Do you have painful swelling in one leg? So that could be a symptom of a deep vein thrombosis or a blood clot in the deeper veins of the leg, not the superficial varicose veins. So if there's a blood clot, that clot could break off and go all the way up through the heart to the lungs and cause what we call a pulmonary embolism. And that could be life-threatening. So if you're getting some acute swelling of one leg, don't wait to go better and don't just try to stretch it out. See a physician. There's some quick tests we can do to rule that out. Do you have shortness of breath on exertion, like with more physical activity? So this could be a symptom of heart disease, the circulation to the heart, that we call coronary artery disease, or heart failure where the heart's not pumping as strong, or anemia where your blood count is low. A respiratory condition like asthma can give you shortness of breath when you're exercising, as can chronic lung disease like emphysema or chronic bronchitis. And of course, if we're out of shape from the pandemic, that can cause some shortness of breath of exertion. So if you're not sure, best to check it out with your physician. So the classic symptoms of heart failure, where the heart's not pumping as strong as before, will be shortness of breath when you're exerting yourself, shortness of breath when you're lying down because blood backs up into the lungs, swelling of your feet and legs, and gaining weight from just retaining that fluid that's not getting pumped back through the heart. So on to the respiratory system. Are you having difficulty breathing? Again, it could be asthma, chronic lung disease, anemia, heart disease, heart failure, possibly lung cancer if you have risk factors, or of course, COVID. So contact your doctor so we can sort it out and ask more questions and an examination. Do you wheeze? So wheeze is a musical sound when we're breathing out. And if you're not playing a clarinet or recorder, of course. So it could be a sign of asthma or bronchitis. Less commonly, but also possible, would be obstruction of an airway. So lung cancer that's blocking the airway can also cause a musical sound when we're exhaling. Have you been coughing? So it could be a symptom of COVID with other symptoms. It could be caused by anything that irritates the airways from the nose on down into the lungs. So it could be a cold or allergies, postnasal drip. Could be from bronchitis, either chronic or acute, from asthma, from acid reflux from the stomach can cause irritation of the larynx or throat. It could be pneumonia, an infection of the lung tissue, or it could be a cancer of the respiratory tract. So if you have a prolonged cough that's going on for over a month, definitely get that checked out with your physician. It could be something simple like allergies, but we don't want to miss any potential cancers that we can treat quickly. And of course, if you coughed up any blood, so of course it could be a nosebleed or broken blood vessels from coughing or vomiting, but it could also be from cancers in the nose or the pharynx or in the lungs as well. So definitely contact a physician soon, like within days, if you've coughed up any blood. Do you have urinary symptoms? Do you have difficulty with urination? So you can have difficulty with the flow of the urine from the frequency, urinating more frequently, or you can lose control of the bladder or have pain when you're urinating. So we can get a decreased flow due to narrowing of the urethra. So that's the opening in the penis, in women, just the urethral opening. That's in the perineal area. So that could be narrowed due to an enlarged prostate or from a tumor or simply from aging, especially after menopause, the urethra could be narrowed. So definitely if you have a significant decrease in the flow of urine, male or female, do consult with your physician as well so we can rule out what the potential causes are and treat it. And of course, symptoms of a bladder infection would be the urge to urinate frequently, more than usual, usually small amounts, and even after you urinate, still feeling the urge to urinate, and often burning in the bladder or in the urethra. So these are similar to the symptoms of urethritis, which can be due to sexually transmitted conditions as well. Incontinence is loss of control, and in the case of the urinary system, that would be loss of control of the bladder. And just a reminder to always look before you flush, especially if you're over 40. So this is if you're in a public washroom and they don't have any paper towels or anything to wash your hands, sometimes we have to resort to flushing with our feet. When I was growing up, we're third generation Chinese, but we assumed that after going to lots of Chinese restrooms that Kung Fu had been invented many ages ago as a way of getting out of a Chinese restaurant washroom without using your hands. But I think it actually has other origins. Do you have blood in your urine? So possible causes could be from a bladder infection where it would only be temporary, from kidney stones, or it could also be from a cancer of the bladder or the kidneys. So if you see blood in the urine, make sure you contact your physician. If it's associated with a bladder infection, we treat the infection, then recheck the urine to make sure there isn't any trace of blood left. And we can do ultrasounds and often refer to a urologist to look a bit further to rule out these more serious causes. And of course, not only do you look before you flush, but you look before you sit down. Who left the seat up, who left the seat down. And so these are actually taken in our staff washroom at Prime Care. I actually found the seat like this one time, and this is not a compromise. This is really dangerous. Always look before you sit down. And another gentle symptom to ask for is, have you had pelvic pains? That's the lower abdomen. So that could be due to ovarian cysts or tumors, could be due to endometriosis, where that endometrial lining that should be inside the uterus is outside of the uterus, like around the tubes or in the abdomen, around the intestine, can cause severe pelvic pain, particularly around the time of the periods. Fibroids or benign growths within the uterus that can cause pain if they're large enough or affecting the periods. And of course, other tumors of the ovaries and the uterus can also cause pelvic pain. And of course, pregnancy, vaginal infections and sexually transmitted infections can also cause pelvic pain. So this is definitely not a symptom to ignore. Are periods irregular, heavy, or painful? So that could be due to hormonal conditions or those fibroids again, or endometriosis. And when the periods stop, it could be due to menopause, pregnancy, breastfeeding, extreme loss of weight, where the estrogen levels drop in women if she's lost lots of weight, or other hormonal conditions. And it's been really common after both COVID infections as well as the COVID vaccine. A lot of women have reported irregularities that are temporary involving their periods. Have you had abnormal vaginal bleeding or spotting? That's small amounts of bleeding, often seen on pads or in the underwear. So this could be due to just hormonal conditions or like a birth control pill that's too light in the estrogen level. But it could also be due to cervical cancer and endometrial cancer. So any bleeding after menopause when periods have stopped for at least a year, any bleeding after that does require prompt attendance with a physician and probably an ultrasound to check the lining of the uterus, and also an exam to make sure there's no signs of cervical cancer, in addition to doing the regular pap smears as recommended. Do you have any groin or genital sores, swelling, or growth? So we can have abnormal lymph nodes, like we sometimes feel lymph nodes underneath the arms. We often can feel the lymph nodes in the groin area. So we all commonly feel those all the time, but if you feel something that's new to you or something there that's getting bigger, definitely get it assessed by a healthcare provider. There can be cancers that can grow in that area as well. So if something looks abnormal, feels abnormal, you're not sure, definitely check it out. We'd rather see you and reassure that it's benign rather than miss something that's potentially dangerous or cancerous. Commonly, we see plugged sebaceous glands or sweat glands. They're the most common things that we see in that area, but not everyone knows what they look like unless they've had them before. So don't hesitate to see your physician to make sure. And we can also get warts. Genital warts and common warts can grow in the genital area. So often the skin looks different and warts actually grow and get bigger, often asymmetrical, often rough and sandpaper on the surface rather than smooth like the surrounding skin. And of course, there's some sexually transmitted infections that can cause little blisters or sores, like the herpes virus, or open ulcers that may not be painful, like with syphilis. So anything new you're not sure of, get it checked out. On to the gastrointestinal system. Do you have difficulty swallowing, like food getting stuck in your throat or in the esophagus partway down? Could be due to narrowing of the esophagus or some growth that's obstructing the passage of the food. So if you're consistently getting food getting stuck, it could be something simple, but it's most important to get it checked out. Do you have heartburn? So that's the burning sensation in the throat or in the chest that could be caused by stomach fluids refluxing up in the esophagus. It could also be due to excessive caffeine that causes more reflux or increases acid, or excessive alcohol that can also directly irritate the esophagus and the stomach. Have you been vomiting? So often people use the term that they were sick, but they really mean that they were vomiting. So frequent and recurrent vomiting may be due to bulimia, an eating disorder. It could be due to an infection, like a gastroenteritis. It could be due to a blood disorder or gallstones or other conditions involving the inside of the abdomen. That feeling of feeling sick, that nausea, is a common symptom of pregnancy, of course, and it could be a symptom of migraine headaches. So severe throbbing headaches associated with nausea with light or smell or taste sensitivity could be due to migraine headaches. So my Uncle Jim said it's not what you know, it's who you know when you're trying to get a new job. But of course, doctors say it's not if you're just vomiting, it's important to know what you're vomiting. So if you vomit blood, it could be from something simple like a bleeding nose if you had one right at the same time, or it could be from a broken blood vessel in the throat, or from a bleeding ulcer in your stomach, or it could be from veins that are dilated in the esophagus. That can happen with chronic overuse of alcohol, what we call esophageal varices. And the amount of bleeding could be quite life-threatening from this. So if you vomit blood, you should get it checked out right away and contact your doctor immediately or go to the emergency. If you vomit up coffee grounds, this is a classic sign of a bleeding ulcer because blood that's partially digested by the acid in the stomach will come up looking like brown coffee grounds. And that is an emergency, and you should go to the emergency department unless you really did eat coffee grounds. Have you had an increase in gas? So this can be often what we're eating, but there could be other causes as well. So as I remind everyone has gas. Even the Queen has gas, but I'm sure there is someone that's highly paid to take credit for it when the Queen passes gas in public formal occasions. It could be someone like Donald Trump, who is kind of shameless in passing gas during televised public occasions as well. But sometimes an increase in gas could be due to something in your diet that you're not digesting. It could be from too much fiber, which in general is a good thing, but fiber is that part of plant material that isn't digested. So it makes the stools more bulky, makes us more regular. But if it just sits there, it can make us more gassy. If we are lactose intolerant, as many adults are as we get older, it's hard for us to digest lactose, which is the sugar in cow's milk. If we eat a lot of fatty food that we're not used to, that can also make us feel bloated and gassy. And if we're constipated, that stool that's just sitting in that large bowel will just sit there and ferment and produce more gas as well. But a serious cause would be a bowel obstruction. So an increase in gas, but not be able to pass that gas, could be an indication of a blockage in the bowel, which would require you to go to the emergency, and you would be in a lot of discomfort and pain with this. Have you had a change in your bowel movements? So a change in both the appearance and the frequency. So has there been a change in the caliber of your stools? So we usually don't say caliber because people are thinking that we're kind of judging their stools to see if it's a number 10 or number 1, but that's not what we mean. We're meaning a change in the diameter of the stools. So are your stools pencil thin or thin as a pin? Or if they're flattened all the time, that could indicate something that's in the abdomen that's pushing on the colon or the intestine, or it could be from something within the colon like a tumor or a polyp that's changing the shape of the stools. So if you notice a consistent change in the shape or diameter of your stools, then that should prompt you to see your doctor to see if you need to do a colonoscopy. Has there been a change in the frequency of your bowel movements? So if you want an interesting conversation at Easter time or other family dinners, you can ask everyone how frequently they have bowel movements, and you will be shocked. And your response will probably shock someone else. Constipation is a decrease in your stool frequency that's often associated with needing to strain and having harder stools, whereas diarrhea is usually described as loose or watery stools. But the normal frequency of stools, usually we kind of settle into it by the time we're 2 or 3 years of age. So some people, kids as well as adults, might have 3 bowel movements a day. Like their system is set up so that When they have a meal, that gives a reflex. With food in the stomach triggers the colon to cramp up, and then they have the urge to have the bowel movement. It doesn't mean that food's passing out right away. So that could be normal for a person, their whole life, 3 bowel movements a day. The average is 1 or 2 bowel movements a day. And a lot of people don't have a bowel movement every day, but might have 3 a week. So a normal range could be 3 a day to 3 a week. So if you had a dinner party, you'd be pretty shocked with people in your own family and your cousins and your friends, where they cannot imagine having more than 1 bowel movement a day, or actually going several days without a bowel movement. So it might give you an increasing sympathy for the people around you. Has there been blood in your stools? So this could be caused by hemorrhoids, like a pretty innocent cause. It could be caused by fissures or tears in the anus, and those are usually quite excruciating. It could be a little abrasion of the delicate lining of the intestine or the rectum due to very hard stools, or it could be due to growths called polyps within the colon, or cancer of the colon or the rectum as well. So the older we get, the more important it is to be prompt about looking after blood in the stools. So melena is a medical term that I want you all to be familiar with. But if you just went off and Googled melena, you'll suddenly see, for the first couple of pages, you'll see just a bunch of pictures of young women named melena. But if we look a bit further, what doctors think about when we hear the term melena is black tarry stools. That's why no physician names his daughter Melena. So black tarry stools is the appearance of blood that is from a bleeding ulcer that gets digested. So usually if you have a slow bleeding ulcer in your stomach, by the time it's digested and gets to the intestine, it looks like this, black tarry stools, as black as my stethoscope. So melena are these black tarry stools caused by digested blood from a bleeding ulcer. So that's a medical emergency. So go to the emergency even if you don't have that upper abdominal pain associated with an ulcer. I've had young patients in their 20s and 30s present with melena, sometimes with upper abdominal pain because they took too much Advil or ibuprofen. That can cause a bleed in the stomach as well, or an ulcer. Now, as I mentioned, there are alarm symptoms. I post in my exam rooms for patients to notice that if they have any of these symptoms, it doesn't matter what else they brought in or that prescription renewal, we have to attend to this right away. So these are symptoms that require prompt medical attention. If you have any of these, you should either go to emergency or contact a doctor the same day. If you have pain that is unexplained, severe, crampy or colicky, electrical and persistent, something new that hasn't been investigated and you don't know what it is, that requires attention. If you have chest pain, especially if it is squeezing and associated with sweating and nausea and spreading to the neck or arm, that could be angina or a heart attack, calling 911, not just waiting for it to get better or taking a cab. If you have pain in the bone, especially if it is unremitting and disturbing your sleep, we want to make sure that's not a bone tumor or bone cancer. If you have the sudden loss of function, like unexplained changes in your speech, in your memory, in your thinking, in your emotions, in your swallowing, loss of function of bowel movements or urination, changes in your heart rhythm, loss of vision, loss of hearing, sudden changes in your balance and coordination, sensation, or muscle function, we want to make sure you're not having a stroke. So again, 911 emergency. If you've had an unexplained sudden or progressive change in your weight, your energy, your appetite, your body temperature being cold all the time, very thirsty all the time, swelling in your legs, or feeling really exhausted with exercise, may not require going to the emergency, but you should contact your physician and see them in the next week or contact them in the next week. If you have some growth, so new or growing lumps in the skin, in the mouth, in the muscles, in the breast, in the scrotum, if you have lymph nodes around the neck, underneath the arms or elsewhere that are growing, if you have skin changes like moles that look really unusual, or persistent sores that aren't healing, that needs medical attention. Again, not 9/11, but don't wait another month to see your doctor. Get it checked out within a month. So here are just some pictures of what we look at for melanoma. So these are moles that have a cancer potential. So the ABCDs of looking at moles would be asymmetry. So if you draw a line down the middle of that pigmented lesion or skin area, if it's not symmetrical both sides, then that would be a reason to get it checked out with a doctor. If the border is not nice and clear and round, but rather scalloped or like a map of a continent, that's abnormal, needs to be looked at by a physician. And if the color is changing or is uneven in that lesion, it requires coming to the doctor. And if the diameter of the mole is bigger than the end of a pencil eraser, it doesn't mean it's cancerous, but that 5 millimeters is often our cutoff for something we're going to keep a closer eye on and look for other features and look at it under good lighting and magnification. And if we have any doubt that it might be cancerous, then we would arrange a biopsy to know definitively. So the ABCDs of moles. Now there are benign skin conditions that could be uneven in color and uneven in shape. If you're not sure, check it out with your doctor. During the pandemic, people have sent lots of pictures. Sometimes even with a good photo, video is terrible for looking at the skin. So our video platforms are terrible. And the photos, I've had maybe 1 in 10 photographs that patients will send in for us to review during our telehealth calls. Maybe 1 in 10 is sharply focused on the skin that we're looking at. Often it's focused on the hair in the background or the carpeting or the picture in the back. So often I end up asking these patients to come in so I can look at it and feel it and make sure that it's nothing to worry about. So bleeding, so again, these things don't require you to go to the emergency, but definitely contacting your doctor and not waiting another month. So bleeding in the urine, in the sputum, in the stools, or vomiting up blood, or abnormal bruising requires attention with your doctor. So if you're seeing blood like this from the urine or throwing that up, make sure you see your physician. So don't wait long. If it's a large amount of blood, contact a doctor right away so you can get an in-person examination. So on to screening tests. So what tests when? So screening tests are really important for early detection of conditions that we can readily treat if we catch them in the early stage. So screening tests are for the general population with average risk, with no symptoms. So for example, if you have symptoms of an ulcer or colon cancer or possible breast cancer or testicular cancer, you're feeling a lump, or there's some major changes in your urination that may be your prostate, don't rely on a screening test. You contact your physician. And we often will do screening sooner than these age limits here, or maybe other tests as well. If you have a family history of colon cancer, for example, we don't wait till you're age 50 before we start screening with stool occult blood tests. We start screening 10 years when you're 10 years younger than the age that your first relative was found to have potentially cancerous colon polyp or colon cancer. And that's screened with a colonoscopy every 5 years. And if you've had polyps before, then we would tell you when you're due for the next colonoscopy, often between 3 and 5 years after the last one. But we have recommendations based on the number of polyps and what the results were. If you have family history of breast cancer, we probably have different recommendations for doing mammograms and other examinations. So these screening tests are people that have just an average risk, no family history, and no symptoms. If you have symptoms of something like a breast cancer or anything that we've talked about previously, do see your physician and don't rely on just the screening tests. So screening for high blood pressure should be done, the guideline is most adults over 18 at every appropriate medical visit, which is usually annually, but a lot of people haven't seen their doctor for almost 3 years because of the pandemic. So often we're relying on home blood pressure machines these days. But of course, if someone is being treated for high blood pressure, then they need to be monitored more frequently. So I often do recommend home blood pressure monitoring too. or checking the blood pressure in the office when we do get to see our patients in person. You can also check in the drugstore, but to make sure that that machine is clean, and asking the pharmacist if it's been calibrated or checked for accuracy recently. Now, the Pap smear is a special screening test for cervical cancer. So it's from a little swab that's taken from the outside and inside of the cervix. So it requires a pelvic exam, but not every pelvic exam with a speculum is a Pap smear. So when I do examinations of patients, I tell them what we're checking for. If we're checking for sexually transmitted infections or yeast infections with swabs, and I'll tell them if we are taking the Pap smear at the same time. So the recommendation is starting at age 25, even if a young woman is sexually active prior to that, Pap smear start at age 25. So relatively new guidelines. And it's continued on to age 69. So it's done every 3 years, starting at age 25. And when a woman turns 70 and they haven't had any abnormal PAPs, 3 normal healthy ones in the previous 10 years, they're all fine, then the recommendation usually is they can stop Pap smears at that time. But you can also check with your family physician because they have your personal history. Also, the BC Cancer Agency processes all the Pap smears and advises when the next one should be due based on any abnormalities they detect. So that could be as early as 6 months, 12 months, 24 months, if there had been previous abnormalities. So the Pap smear is used with one of these 2 devices or both of them. So it's called the Ayers spatula, that's the wider one. And there's the Cytobrush, thinner brush. So the Cytobrush is more effective for getting samples from inside the cervix and definitely useful to use if a woman hasn't had children yet because the cervix is narrower and closed. So we get a better sample of the inside of the cervix with this. Diabetes should be screened if someone is at higher risk. We used to screen everyone at age 40, but there's a risk factor calculator called FindRisk or CanRisk that you can look at online. But physicians will also calculate this, knowing their patient's history and age. So those at higher risk, for example, if someone has high blood pressure, risk factors for heart disease, family history of diabetes, if they've had gestational diabetes, diabetes in pregnancy with a prior pregnancy, they are at higher risk and then should be checked at least every 3 to 5 years. And then depending on those results, we might actually check more frequently if we do get an abnormal fasting blood glucose or glucose tolerance test, or the hemoglobin A1C, also called glycosylated hemoglobin. It's a non-fasting test that checks the average blood sugar level. If people are at very high risk with numerous risk factors, according to these risk calculators, then they're checked every year. And that would include someone that has a high fasting sugar between 6.8 and 6.9, kind of approaching the 7.0 or higher that would diagnose diabetes. So those people are at higher risk and should be checked more frequently. So breast cancer, the screening can start at age 40, but the current recommendation is starting at age 50. And the reason is cost effectiveness, risk versus harm when they did some evidence-based studies, although a lot of physicians like myself still would recommend starting at age 40. So we discuss that with individual patients. So it is true that if you start at a younger age, then you might detect more abnormalities on the mammogram that might prompt more investigations than diagnostic mammograms and sometimes biopsies. And although they don't cause necessarily any harm, they do cause a lot of distress. So that's something I would talk over with my patient that's over 40, whether they should start screening at age 40, where we can detect aggressive breast cancers earlier than if we wait at age 50. But certainly for all women age 50 or older, should do a screening mammogram every 2 years, But if there's a family history of a first-degree relative with breast cancer, like a sister, mother, or daughter with breast cancer, then we'd recommend the screen every year for those women. So you can contact the screening mammography program if you're over age 40 to see and book your own online appointment. Once you're registered with the program, you will get a reminder every 2 years by mail. The screen for colon cancer that's available to everyone in BC over age 50 is the FIT test. So it's a specific test looking for micro traces of blood that's specific to the large bowel. So it actually won't detect blood coming from the stomach, but only from the large intestine. So it's very sensitive, and it's a much smaller amount of stool than you need. So it's just this tiny, tiny applicator, and that's almost actual size probably on your screen, unless you're watching on a big screen TV. So it's very tiny. It's just a small amount of stool it needs. Your doctor would give you the requisition. The lab will give you this kit. It's just really easy to do. I've done it myself because I'm over age 50. So it's really easy to do. It's just a tiny sample. It's a little tissue paper you put in the toilet bowl, and you just touch that little tip, just that portion of the tip where you see those ridges to get that sample. Then you put it in the kit, put it in the envelope, and then return it to the lab. If you're shy, get your spouse to return it to the lab. So all adults over age 50 should do this every 2 to 3 years, although the recommendation in BC is every 2 years. But if you see blood in your stool, don't rely on this test. Contact your doctor to see if we should be sending you for a colonoscopy. If you're close to 50 or older, we see blood in the stool, we're not going to rely on this test. We might send you straight for the picture on the bottom, which is a colonoscopy, of course, explaining risks and benefits as well. So this is performed by a gastroenterologist or general surgeon with expertise in snaking this scope all the way up through the rectum, through the sigmoid colon, the transverse colon, the descending colon, all the way up to the appendix or cecum. So that can visually detect any polyps and allow us to actually remove those polyps completely and send them to the lab to confirm that they're benign, cancerous, or potentially precancerous. So if you've had a colonoscopy where potentially cancerous polyps were removed or cancer has been found, you're not going to rely on these screening tests. You'll have regular colonoscopy set up at specific intervals. That might be 1 year, 3 year, 5 years, or something in between. In BC, they don't have a program for colonoscopies to be done on people with no family history without any symptoms. You can get a private colonoscopy done at great cost, but currently BC is not typically funding just colonoscopies or sigmoidoscopies in asymptomatic people just for screening. In other provinces and in some places in the States, the routine is just to do a colonoscopy every 10 years and then not doing the FIT test. So to screen for prostate cancer, one way, so men over 50 should probably do this digital rectal exam. So unfortunately, it's not a high-tech exam, so I showed you the picture. Digit refers to the finger, and of course the gloved finger with lots of lubricant. So we can access and feel over the back of the prostate with a gloved finger. And men over age 50 should do it roughly every year. But if you're getting symptoms of decreased flow in your urine, increased frequency, we probably have to check it when you're getting those symptoms to assess the size of the prostate and to rule out a tumor or a prostate cancer we can feel. And if you just get the rectal exam and you don't ask for the doctor for a second opinion right away, because then you're just going to use another finger. Or he'll ask his colleague down the hall that has an even longer finger. But another test could be the PSA blood test. So if you look in that picture, you can see that we can't feel the whole prostate doing the rectal exam because there's an anterior portion to the prostate that's beyond reach. And only if a tumor or nodule is very large and hard will we be feeling one that's more in the front, anterior, than one that's in the back. So we're going to miss a bit. We can tell the size of the prostate, but we might miss that nodule if it's not in the posterior prostate. So another test that could be done is the PSA, prostatic specific antigen. So it's a protein produced by the prostate in all men, and the number gradually increases with age. So we know that it will grow as a prostate grows. And for most men, it's benign prostatic hypertrophy or benign growth of the prostate that is not cancerous. So that can cause the PSA to slowly go up over time. So the PSA is not meant to be a screen or a routine screen for all men for prostate cancer, because it really has to be interpreted with symptoms, the size of the prostate, and that man's risk factors and that man's general health. So we shouldn't necessarily do a PSA on an 80-year-old man, because we might detect a slight abnormality of the prostate, but that man's life expectancy from other conditions might suggest that if we aggressively identify, investigate, and treat for prostate cancer, it will cause more harm to him, and that prostate cancer may not spread or cause any problems. So it's a careful discussion all men over 50 or men that have a family history of prostate cancer should discuss with their family physician. Some of my patients that we have diagnosed prostate cancer early, where we couldn't feel it with that examination because we did the PSA test, are really thankful for that test and would recommend it to all their colleagues or friends that are approaching age 50 as well. So it depends on the individual. Unfortunately, the PSA is not covered. A simple blood test is not covered. And Life Labs charges currently about $37 to do it as a screening test for any man, even if you're over 50, unless we have certainty or high index suspicion that we feel a prostate cancer or they have a prostate cancer that we're following. Those are the only cases that we can charge MSP. So discussion with your family physician of whether or not you should be screening for prostate cancer or doing the PSA. So again, screening tests are for individuals with no symptoms of these conditions and at average risk. And if you have symptoms or family history of these conditions, talk to your doctor about the specific recommended earlier, more frequent screening tests that you should do for your condition. And just a reminder about what is health, that it's not the absence of disease or the treatment or cure of disease. This is my personal opinion that health is the optimal balance of the important areas of your life based on what you as an individual value, where you find meaning in your life, and the achievement of your positive potential. And I see as my personal mission is to achieve my positive potential in life by helping others achieve theirs. That includes you, my kids, my wife, my relatives, my patients, and everyone in my community, everyone that I can help with my articles or my talks, that I can help them achieve their potential. So this is a little Mandela that I made, kind of Zen-like, but about the important areas of your life, your social life, your physical well-being, healthy environment, financial well-being, just having enough and not being burdened by debt, satisfying, meaningful work, happy, harmonious family life, a balanced mind, emotional well-being, spiritual well-being, and a balance of rest and play. These are the important things to balance. And life is about balance, because sometimes these spheres in your life, like work, can consume a lot, especially in my kind of work. So we need to balance it with all the important areas that comprise your whole life. And at the center of it is your calling, your mission at this time in your life. I'd like you to imagine achieving your positive potential and helping the people in your community and the people you're in touch with achieving theirs. And together, I'd like you to share anything significant or important that you've learned today with people that you care about and your neighbor. So together, let's create a healthier community. And remembering why we are here, and not for just our immediate family, but for our friends, our community, and everyone in our circle of influence in the future, really expanding our circle of care, just for family doctors, but each of you as well. So just a friendly reminder that my next talk is on healthy eating. So I'll talk about some of the popular diets, but also the latest recommendations for the Canada Guide to Healthy Eating, what they used to call the Canada Food Guide. So it's changed a lot over the past couple of years compared to what you might have known 10 years ago when it was much more complicated. So very sensible advice based on the Canada Food Guide, and some talks about other popular diets like the keto diets or the intermittent fasting. So the pros and cons and what you should watch out for those. That'll be Thursday, April 21st, same time, same channel. And I'd like to see you all there as well.
And I've just popped the registration link into the chat so people can register for it right now.
Perfect timing. And I'm sure none of you had sleep apnea or got bored or fell asleep. So I would like to answer any questions you might have on anything we've talked about, or anything that's not a personal medical problem for which you should seek your own personal healthcare advice from your healthcare provider. So
I do have one question, and it says, my stool looks like some pebble stone. Also, I have constipation. Even when I take Metamucil every morning, my stool does not go back to normal. What can I do?
Of course, I can't give medical advice of what you should take, but if that's been a change or is causing a lot of distress or discomfort, you definitely should contact your family physician. And if you don't have a family physician, I think that's perfectly appropriate to take that to a walk-in clinic physician. So it could be a phone conversation or telehealth, but it should prompt at least a physical examination of your abdomen. Among other things, maybe it might require a rectal exam to make sure there isn't anything affecting the shape of the stool. So it will require more personal questioning from the physician and a physical examination as well before them providing any prescriptions. Good question.
So Craig has a question for you. So I've just unmuted him.
Hello there.
Hi, Craig.
Hello there. My apologies. I'm in an echoey room right now rather than a soundproof booth, but my apologies if this was mentioned. I got called away for a couple of minutes. But is there any tips for differentiating seasonal allergies, which are quite popular this year? The flowers look pretty and everything, but a lot of people start sneezing. How can you differentiate seasonal allergies from COVID? And how often can it be both? And the same thing for flu and COVID, which I know a lot of the media have called co-flu. How often can it be a combination of both or a combination of all of those?
Well, allergies, typically people have had allergies before, although this year with the earlier sunny weather, earlier than usual, people had an earlier onset, and people notice some minor changes in their allergy symptoms from year to year. But if you have allergies, you'll get them around the same time every year. And typically it would be itchy, watery eyes, runny, watery nose. So it would be clear, drippy congestion with sneezing from irritation in the nose and sinuses. And if the cough is not a cough that's really chesty within the chest itself, unless it's someone with asthma that has an allergic asthma cough, but they would know they have asthma. And even though we call it hay fever, there's never a fever with hay fever. So if it's seasonal allergies affecting the eyes or the nose and a tickle in the throat, you won't get that loss of taste, total loss of taste or smell that you would get with COVID. But not everyone with COVID will have a loss of taste or smell. And typically with COVID, you would feel unwell, like a flu, fever or chills, muscle aches. With Omicron, typically really bad headaches that are different from headaches you've experienced before. And the fatigue is quite extreme fatigue and feeling out of breath. So you would know for sure that it's not your typical allergies. A cold can be similar, but typically for adults, you're not going to get a fever with a cold. You'll just get a runny nose. It won't be clear and watery like allergies, but it can be a little bit yellowy or a bit more opaque. It shouldn't have much taste to it at all. And it'd be just all up here, nose and sinuses, a bit the ears. You wouldn't have a really bad cough with a little cold, but you might be sneezing a bit. If you had COVID, often it can start here with a headache, severe nasal congestion, dry, scratchy throat, maybe loss of taste, loss of smell. And then later it can descend on into the chest. But people having these symptoms often do have that bad headache, the muscle aches, and the fever. So it can feel like a bit of the flu, but I haven't seen any patients with the flu in the past month. And this is not flu season. And there's no big outbreaks of flu that any of my colleagues here have seen at Prime Care as well. So if you're feeling flu-like and getting respiratory symptoms, certainly do the rapid test, knowing that 75% of the time, you might pick it up in the first 3 days of COVID, but there's a lot of false negatives. I have lots of patients that keep checking the first 3 days of symptoms, certainly checking before symptoms, often negative. And then the 5th day with terrible symptoms, then it turns out to be positive. So if you have the symptoms, even with a negative test, still isolate for the 5 days, re-swab again before you come out of isolation. And so rapid tests are available for everyone from the pharmacy, free. You can get a kit of 5, anyone 18 and over. So I do encourage you all to get it so that you can have it for multiple testing if you do get any of these symptoms, just to make sure. So good question, very, very topical, Craig.
Thank you.
That's a good one. So actually there was no other questions that came up in the chat. We did have Elaine put her hand up earlier on in your talk, and so did Teresa. So I don't know if either one would like to ask a question. I've just given them the ability to speak up if they'd like. But if not, that was it for questions.
That's great. So I hope this was good information for you. And again, if you found anything useful, you can download the slide presentation. Leona already put up the link. And you can download the key facts. I do that for each of our talks. So you could do that for this talk or any of my previous talks. And a lot of videos from the past year you can look online in case there's nothing on Disney Plus or Netflix this weekend.
Craig just had one more question. He said, you mentioned in previous chats that you would not go to a Canucks game in person. Has that changed, or are you still watching on TV?
I have to confess, I don't watch all the Canucks games. And I know that Craig goes to every single Canucks game. It's in person. People don't have to wear masks now. Is that right, Craig? So with the last change in the mask mandate, and after families have been traveling over spring break, and with Omicron BA2 now in the province and increasing numbers across the country and around the world, I would not feel comfortable going unless I'm wearing an N95 mask.
Well, I think we covered it. We did it, and almost on time. We did well today. That's
awesome.
That's awesome. So I'll just say that when we close down the session, an evaluation screen will pop up, and if you have a moment, please take a moment to fill it out. We really value your input, and
yeah, you can make it even better next time. And thank you, Leona.
Thanks, Dr. Wong.
See you soon.
Everybody have a great night.
Stay safe.
You too. Bye-bye.
Bye.